This video is about practicing mindfulness, and it's part of the series put out by the Jefferson Center City Clinic for Behavioral Medicine in the Department of Psychiatry and Human Behavior. The series is called Mental Health for Healthcare Providers in the COVID-19 Pandemic. The presentation was created by Madelena, Rizzo, Anna Franklin, who are under the supervision of Virginia O'Hare. So mindfulness, what it is and how to do it. The learning objective for this video is to increase your knowledge of mindfulness, what it is, how to practice it, and how to incorporate it into your everyday life. How can mindfulness be useful? Every day, we are bombarded with emails, phone calls, patient visits, documentation, family responsibilities, and on and on. When we try to attend to all of them then, it's no wonder we feel overwhelmed and incapable. Mindfulness is a way of moving through the world and paying attention to each moment without becoming attached to it and without labeling it as good or bad. So what is it? Mindfulness is utilized in three main modalities: observation, description, and participation. Try to observe your thoughts, feelings, and physical sensations by asking questions such as, what thought am I having? What emotion is this situation invoking in me? How is my body reacting to this moment? It's important to accept them as is without trying to alter them. Describe your experience with words and identify thoughts as thoughts, feelings as feelings, and actions as actions. Often we muddle the categories and cause ourselves more distress. It's also important when we're describing to use just the facts, instead of inserting our opinions or judgments. Participation is about being completely immersed in an activity, devoting attention and intention to it. So now that we know what it is, what qualities should characterize the experience? First, as was mentioned previously, it's essential to be non-judgmental. Try your best not to evaluate what's in front of you, and if you do notice yourself judging, don't judge yourself to be inept. This is just as bad as focusing judgment outward, to focus it inward. You should also practice mindfulness one mindfully. This means being fully present, not multitasking, and avoiding distractions to the extent possible. Effective mindfulness isn't about getting it right, but instead, it's about doing what is needed in the moment. The wonderful thing about mindfulness is it doesn't require any special equipment or skill. Mindfulness can be done anywhere, by anyone. And it doesn't have to be silent meditation, but it can be. So now that we've gone over what it is and how to do it in a general sense, we'll ask you to just take a few moments to practice this. So sit comfortably in a chair or on the floor. Notice the breath without trying to change it. And gently close your eyes. As you breathe, with your eyes closed, relax your shoulders. Listen to my voice as I guide you through this brief meditation. Feel the breath going in and out, and in and out. No need to change it. No need to judge it, or judge yourself, or judge anything. Just be. Imagine a river or a stream with leaves floating down. And each leaf that goes by represents a thought. We have so many thoughts, just like there are so many leaves. But like the leaves on the stream, we can watch as they go by. We don't need to become attached to them. We don't need to try to rid ourselves of them. It's not possible. Just be. When you're ready, you can open your eyes. So during this brief meditation, you may have to remind yourself to return your awareness to your breath over and over again. But that's okay. That's your only job. With COVID-19, many people are in distress, and that creates an additional burden for care providers who may be trying to handle their own distress. Use mindfulness to explore how you are feeling, what your limits are, and when you need to do something for your own mental health. There are many general resources and also provider-specific ones displayed on the next few slides. Remember, we are best able to help others when our own needs have been met. This includes physical needs, mental needs, and emotional needs. You don't have to be in a crisis to benefit from help. But if you are, it's even more important that you reach out to others. Thanks so much for watching.